All right, we're now talking about section 3 of chapter 9 on joint articulations, or we should say skeletal articulations. We're now referring to cartilaginous joints. We just talked about the fibrous joints. With cartilaginous joints, you should be able to describe the locations and functions of synchondroses and name the locations of symphyses and their functions in these locations. So far as properties of cartilaginous joints, they're either hyaline cartilage or they're fiber cartilage between bones. They lack a joint cavity, they're immobile or they're slightly mobile, and they're either synchondroses or symphyses. And these bones are joined by hyaline cartilage when you're talking about synchondroses, and they're immobile. They're also synarthroses. The epiphyseal plate is an example here where it contains hyaline cartilage, and of course here at the ribs, connection to the ribs and the sternum here along there, and these costochondrial joints are immobile joints between the rib and costal cartilage. Symphyses are pads of fiber cartilage that are between articulating bones. They resist compression and they act as shock absorbers. They allow slight mobility. They are amphiarthroses. An example here being the pubic symphysis of the pelvis, as well as the intervertebral joints, the intervertebral discs, the body of the vertebrae. And then as far as clinical view, costochondritis is inflammation of the costochondrial joints. There's localized chest pain. Cause is usually unknown, like unfortunately so many disorders or diseases, due to trauma or infection of some type or another. It may be mistaken for pain from a myocardial infarction, which is always a challenge whenever there's pain in the chest area. Is someone having a heart attack or is it something else, which of course requires medical attention to determine that. And it's treated with non-steroidal anti-inflammatory drugs, NSAIDs. So what did you learn? You should be able to define the composition of a synchondrosis and where in the body that is found, and in what functional category is a symphysis placed, and why is it in this category. With section 4, now we're talking about synovial joints, the last of our basic joint structures of our 3. You should be able to identify the characteristics that are common to all synovial joints, to list the basic features of a synovial joint, to describe the composition and function of synovial fluid in a typical synovial joint, explain the movement of a joint with respect to the 3 perpendicular axes of space, and compare and contrast the 6 types of synovial joints. So synovial joints. There are bones that are separated by a joint cavity. The only ones of the 3 types of joints that have a joint cavity between. This is most joints in the body. They are diarthroses. All diarthroses are synovial joints, and all synovial joints are diarthroses. Okay? They're freely mobile. All with the same basic features. There's an articular capsule and joint cavity, synovial fluid, articular cartilage, and ligaments, nerves, and blood vessels. And so here's an image of a synovial joint. Here we have the periosteum of the bone, in this case. And then we have basically at the end here, we have our articular cartilage at end of each of these bones, and the joint space, joint cavity containing a synovial fluid between those 2 bones, synovial membrane, outside layer of that bone between the last point of contact, so to speak, on the sides here, excuse me. Okay. And I miss anything else? The yellow bone marrow course is pointing to inside the bone here as well. And the articular capsule referring to that fibrous layer and the synovial membrane. Okay. And of course, ligaments are what's going to be holding that joint basically in place. Not to be confused with tendons, which are more related to activity of muscle, relationship with muscle between muscle and bones. But bone connecting to bone, ligaments are playing their greater role. As far as the double-layered joint capsule, the articular capsule, there's that outer fibrous layer like we just took a look at, and the inner synovial membrane. That outer fibrous layer is formed from dense connective tissue, and it strengthens the joints to prevent bones from being pulled apart. Whereas this inner synovial membrane is composed primarily of the areolar connective tissue, and it covers internal joint surfaces that are not covered by cartilage, helps produce that synovial fluid, which helps keep that joint lubricated and helping it maintain its mobility and decreased stress on the joint during motion and during stress. Articular cartilage is the hyaline cartilage on the bone surface at a joint, and its function is to reduce friction during movement, cushion to absorb joint compression. And remember, joint compressive forces, we'll repeat this a lot, that's the way bone builds up from the standpoint of the periosteum for appositional growth. It has to be compressive type force activity to get that. They often use the phrase weight bearing, but it's compressive forces specifically, okay? And the function of that articular cartilage also is to prevent damage to articulating ends of bones. That said, the articular cartilage does lack a perichondrium. It is avascular, okay? The joint cavity, space between, these bones, these two articulating bones coming together, this joint, is lined by a synovial membrane secreting synovial fluid. It's a viscous, oily substance. It lubricates the articular cartilage on those articulating surfaces. It nourishes and removes wastes from the articular cartilage's chondrocytes. You should definitely know that. Acts as a shock absorber, very important. The ligaments are composed of dense, regular connective tissue. They connect one bone to another bone. They stabilize. They can strengthen. They add strength, or they add stability, and in adding stability, they add strength or support. Strengthen is kind of an odd word to use from a general standpoint, being that really muscle provides force production, which is strength, whereas ligaments really don't provide significant force production other than to try to maintain position. They allow some motion, they also limit it. They have some elasticity, but they're mostly meant to restrict motion to some extent. And they reinforce these synovial joints. Extrinsic ligaments are physically separate from the joint capsule, whereas intrinsic ligaments are the thickening of the articular capsule itself and includes ligaments outside and within the joint capsule. Now, these synovial joints also have sensory nerves and blood vessels. There are numerous numbers of those in the synovial joints. The nerves, of course, detect pain stimuli, they report movement and stretch, so length, they report on length, motion, range of motion, and of course pain. Tendons are composed of dense, regular connective tissue. They're not part of the synovial joint itself. They attach muscle to bone, as we mentioned, and they help stabilize joints. They help them maintain the connection, at least anyway. They provide some stability. Although the primary purpose really is to assist with motion. Bursae, the bursa sacs. They're fibrous, sac-like structures that contain synovial fluid. They're lined internally by the synovial membrane. They're found in synovial joints where bones, ligaments, muscles, skin, or tendons rub together. They're connected to or separate from the joint cavity, and they alleviate friction. Now, oftentimes you'll hear about bursitis or someone breaking that bursa sac. Its job is to protect. It's supposed to go first, as opposed to the joint itself or the bones. For the bursae of the knee joint, or a single bursa, bursae being plural, is deep in this case to the gastrocnemius muscle. We're looking at basically looking at the knee here. Here we have a suprapatellar bursa and the femur coming here to meet that tibia here. Okay, it's a joint cavity, of course, space between there. It's a fat pad over here. There's always going to be some fat there helping provide insulation and support as well. Articular cartilage, the hyaline cartilage here, lining the end of that. In this case, the distal epiphysis of that femur there. An articular capsule, of course, synovial membrane on the outside of that femur here at the base, near the distal portion there, near the epiphysis. And of course, the patella here is a floating bone here. Did I miss anything else? Patellar ligament here, playing a role in supporting and attaching that tibia to that patella. That's patellar ligament's primary job there, maintaining its position to the best of its ability to do so. Other accessory structures, tendon sheaths are elongated bursae. They wrap around the tendons where the friction is excessive. They're common in the wrist and the ankle, where you find those tendon sheaths. Fat pads with their protective packing material in the joint periphery, and they can fill spaces when joint shape changes. So looking at our wrist and our hand, our tendon sheath here, basically when it's opened, you can see it here. Tendon of the flexor is for the digitorum profundus. The muscles that actually activate or provide motion for our hand are technically not in the hand itself. The standpoint of activation there, the initiation of it comes actually more toward the forearm and across the wrist into the fingers. The tendon of the flexor is a digitorum superficialis, and the digital tendon sheaths here. Okay, tendon sheath around the flexor pollicis longus tendon. I should say the origins, to be really clear. Muscles do obviously go into the fingers, but they originate outside that hand. Common flexor tendon sheath here, and then you see different tendon sheaths here around actually we mentioned the pollicis longus of the tendon, I believe, already here for the thumb. We won't spend too much time on those, but you should know, generally speaking, the basics of those. As far as classifications of basic motions, we have basically three types of joint capacities for movement. We have a uniaxial joint, where a bone moves in just one plane. It can only go one way. They're forward and backward, or abduction, adduction, or flexion, extension, or just rotation only, that kind of thing. Biaxial joint, bone can move in two planes or axes, and a multiaxial joint can move in multiple planes or axes. And so we have our basic plane joints, hinge joints, pivot joints, condylar joints, saddle joints, and ball and socket joints that are based upon the shape of the joint and the joint surfaces. And this is the order from least to most mobile. Plane joints being least mobile, and ball and socket, like our shoulder joint, being the most mobile. So plane joints have our flat articular surfaces. They're the simplest, least mobile of the synovial articulations. They're limited to side-to-side gliding type motion in a single plane. Hinge joint has a convex surface with concave depression. It's uniaxial, like the hinge of a door. Okay, typically like your elbow is pretty close to it. It's basically a hinge type joint. Your pivot joint is a bone with a rounded surface that fits into a ligament ring, and it's a uniaxial joint where there's rotation on the longitudinal axis. Condylar joint has oval convex surface that's articulating with a concave surface, is biaxial. We have the condyles like of our knee. Saddle joint, convex and concave surfaces resembling a saddle shape. It's biaxial. And the ball and socket joint, like we're talking about the glenohumeral joint being a primary example here, spherical head of one bone fitting into a cup-like socket, although the socket is actually smaller than the bone, whereas most people tend to think of the socket being bigger than the bone, whereas the head of that humerus. It's multiaxial, permitting movement in 3 planes. It's the most freely movable joint of the synoarthrotic or synovial joints. So what are the basic characteristics of all types of synovial joints? You should be able to answer that now. What's the purpose of synovial fluid in the joint? And what types of movements do each of the 6 kinds of joints allow? And we'll come back for section 5 here shortly.